So this case, this is a 0, day old baby with respiratory distress, and this is a X-ray of the chest, abdomen, and pelvis of so findings here. First finding is, so can you see this? What do you think the abnormality here is? So let's start counting the thoracic vertebrae here. Okay, so this is the first rib, the second rib, so the first rib and the first vertebrae, the second rib and the second vertebrae, second thoracic vertebrae. So this is the third thoracic vertebrae, fourth thoracic vertebrae, fifth, sixth, seventh, eighth, ninth, 10th thoracic vertebrae. Okay, so here the first finding is that there are 10 thoracic vertebrae with associated ribs. There are 10 thoracic vertebrae with associated ribs. Okay, after that, can you see this? I think this is another vertebrae, but it is of abnormal shape and abnormal density and with no associated rib. Okay, so let's describe this here. There is a further rounded, dense vertebra lying slightly to the left of the midline inferiorly. Okay, there is a further rounded, more dense vertebra lying slightly to the left of the midline inferiorly. After this, can you see this? There is another or a further pair of ribs with no associated vertebral body, without vertebral body. Okay, so let's describe this. There is a further pair of ribs without vertebral body. After this pair of ribs What do you think you can see here? There is no visible lumbar or sacral spine. This is very important, and this is the diagnosis here, okay? So there is no visible lumbar or sacral spine. No visible lumbar or sacral spine. Okay. What about the iliac bone here? The iliac bones appear to meet in the midline posteriorly. So the iliac bones here appear to meet in the midline posteriorly, and no gaze in the distribution of the rectum. Okay, so next finding, after no visible lumbar or sacral spine, the iliac bones appear to meet in the midline posteriorly. The iliac bones appear to meet in the midline posteriorly. No gaze in the distribution of the rectum. Okay, this is the gaze of the bowel loops. However, no gaze in the distribution of the rectum. So next finding, no gaze in the distribution of the rectum. Next finding, can you see this tube? The nasogastric tube tip is in the midline. Sorry, the nasogastric tube tip is projected over the stomach, or is seen below the diaphragm. Projected over the stomach and seen below the diaphragm. Next finding, nasogastric tube tip projected over the stomach. This is how to comment on the nasogastric tube. Okay, the nasogastric tube is projected over the stomach. Next finding, this. Can you see this tube? This is the umbilical venous catheter. It's not the umbilical arterial catheter, okay? This is the umbilical venous catheter because it's slightly to the right, okay? So the umbilical venous catheter tip projected over the course of the falciform ligament. It's near to the junction of the IVC and the right atrium. Okay, so this is the normal position of the umbilical venous catheter tip. And this is how to comment on umbilical venous catheter. The umbilical venous catheter tip projected over the course of the falciform ligament. Falciform ligament. The falciform ligament. Next finding. There is no other finding. Okay, so the appearance here, what do you think the diagnosis here? Diagnosis here is caudal agenesis. Okay, caudal agenesis. So the appearance are consistent with caudal agenesis. Conclusion. Caudal agenesis. Caudal agenesis. So I think that's all for this case.